Now you can also see radio.
Equinoxe.
Equinoxe Télévision, au-delà de l'image, nous rendons compte. Equinoxe Télévision, au-delà.
A sunny day right here in the economic capital, Douala. Good afternoon, ladies and gentlemen, and thanks for joining me on yet another edition of the program You and Your Health and on Equinoxe Radio Multimedia. For presentation, I am Immaculate Fogwe. According to the World Health Organization, 129 people have died of meningitis in the Eastern Democratic Republic of Congo. A total of 261 suspected cases have been recorded so far. Today, we are going to be discussing on the signs and symptoms and how to possibly prevent the disease. Let's go on a short break. I will be right back. Welcome back. On the line is Dr. Leonard Ngaka, neurologist at the Yaoundé Central Hospital. Good day, doctor. It is a pleasure having you on the program today.
Good day, Fogwe. It's my pleasure being online with you.
So, doctor, today we are going to be discussing about meningitis, which is now an epidemic right there in Eastern Republic of Congo. So, what exactly is meningitis?
Meningitis is a brain infection, actually. In fact, before I define what it is, meningitis, there are two main things. We have meninge and we have itis. Meninge talks about brain, the tissue that covers the brain. Actually, the human brain has sheets that cover them. There are different layers, and these sheets to protect the brain. And these sheets are called meninges. So, meningitis, itis in medicine would mean inflammation. So when you join it with the word meningitis, it means it's an inflammation of the meninges. So meningitis is a condition in which we have inflammation of those sheets which cover the human brain. And it has different manifestations. So typically it is inflammation of those groups of tissues or sheets that cover the brain that gives the condition we call meningitis.
So now we have had 129 people who recently died in the Eastern Democratic Republic of Congo. How common is meningitis right here in Cameroon?
Meningitis is a very common disease. The prevalence is very high. It's true, over the years, the prevalence has reduced over the years significantly, but the number of cases of meningitis are still very high, especially in special groups who have underlying pathologies, like those who are immunocompromised with HIV. Meningitis is very common in that group. So, in general, if we look at meningitis, I'll look at two main groups. We have children below the age of 5. Meningitis is common in that age because of immaturity of the immune system. It's quite common. And the other group in adults, it is mostly common in those who already have underlying comorbidities like HIV, maybe a cancer or any other condition that weakens the immune system. So it's common in those two groups and amongst the old. So those are the groups in which we have meningitis commonly.
Okay, and what are some of the causes of meningitis?
Sorry, I didn't get you well.
What are some of the causes? What can cause someone to suffer from meningitis?
There are many causes of meningitis. There are tons of causes. We have infectious and non-infectious causes. For the infectious causes, we have different infections ranging from virals. We have viral infections like common flu, HIV, even current COVID-19, a coronavirus can give meningitis. For the bacterial causes, we have Neisseria meningitis and pneumonia and Streptococcus pneumonia. Neisseria meningitis is what gives the epidemic form of meningitis, which is what we have in DR Congo. They have the Neisseria meningitis, which when one person has that form, it is easily spread from person to person, and therefore there is a need for the whole health system, including WHO, to be mobilized to fight it. If not continuous spreading, like we could see an example of an epidemic is what we are living right now, is COVID-19. We see how it spreads.
Exactly.
And meningitis caused by Neisseria meningitis, it's an epidemic. And knowing how deadly meningitis are, if we could allow it spread in our community, the death rate will be a very high. In fact, let's look back in Congo, in DR Congo, which you just cited a while ago. They've had about 261 cases, and among the 261 cases, we've had about 130 deaths so far. So we have a mortality rate of about 50%, which is very high.
Very high.
So meningitis by Neisseria meningitis, which gives the epidemic form of meningitis, is really deadly. So it's important that it's protected, that we are protected from it, or we see how to limit its spread.
So what are some of the
bacterial causes? We have fungal causes of meningitis, like Cryptococcus, and we have a few other causes which could be parasitic, like trypanosomiasis. So generally, most infections we have around can cause meningitis. Now, there are other non-infectious causes like cancer. Some forms of cancers can give meningitis of cancerous origin, but the most common causes are the infectious causes of meningitis.
So, talking about the different causes you just mentioned, do they manifest differently when it's fungi or when it's bacteria, or are the manifestations all the same?
The manifestations of meningitis are essentially the same. What are the symptoms the patient will present with? It starts with headaches, violent generalized headaches. Associated to these headaches, the patient might complain of photophobia. That means the patient dislikes light. Each time he's exposed to great light, he feels he has an uncomfortable feeling, and they will say the person tries to, he bends and hides away from light. Mm-hmm. So we have headaches, we have photophobia. Associated to that, the patient can present with constipation and fever. Usually, apart from that, he can equally talk about neck pains. So the most common signs of meningitis, we have headaches. What are the characteristics of these headaches? The headaches will have headaches with photophobia, headaches aggravated by light, and we have associated to these headaches, we have constipation, neck stiffness and pain, and a fever. In some cases, it might evolve to touch the brain parenchyma, and in that case, the patient could have convulsions. But the most common would be headaches, vomiting, and fever.
And so how is it diagnosed?
Yes. Typically, when the patient comes to the hospital with these symptoms, first of all, there are other physical exams the patient will do, the doctor will do in order to ascertain that meningitis, and they'll need to do a lumbar tap, a lumbar puncture. The lumbar puncture extracts cerebrospinal fluid. Cerebrospinal fluid is a liquid which is found in the meninges. We are going to extract that fluid, analyze to find out the germ which is causing the meningitis. When the germ is isolated, appropriate treatment will be given to remedy the situation. I would like to say that meningitis is an emergency. It's an emergency, and so each time the suspected, the medical team is greatly mobilized fast enough to put the required treatment, without which the patient, it could have devastating effects on the patient. Just like we saw that in Congo, the epidemic form has a mortality rate of about 50%. And for the other ones, if the patient doesn't die from meningitis, it might leave him with sequelae, with unpleasant sequelae like cognitive problems, or the patient could even have maybe a paralysis, or can lose sight, or even lost his hearing. So it has a lot of unpleasant sequelae that could come out in this condition. So it's important that the diagnosis is done early enough and treatment started. And for that to happen, each time we suspect that we have headaches and fever and vomiting and all of that, contact your healthcare personnel as soon as possible so a diagnosis can be made and appropriate treatment started early enough.
So is it transmissible?
Sorry, I didn't get you well.
How is it transmissible? How does it spread from one person to another?
Okay, very good. For the epidemic form, which is Neisseria meningitis, which we have in DR Congo, it is transmissible. When we talk about when something is already an epidemic, no, it easily transmitted from one person to another. And the most easy means of transmission is through contact. When you come in contact with somebody who has meningitis, you are exposed. And so if you touch the person, you are in close contact with the person, you will get infected.
Okay.
Apart from this form, which is the epidemic form, we have other causes of meningitis which are common in our milieu. We have somebody who has sinusitis, inflammation of the sinuses. It could be due to an infection. That infection can continue propagating and enters the brain and cause an inflammation on the meninges. If somebody has maybe a lung infection, maybe a pneumonia, those same germs can continue migrating until it enters the brain. So it can move from one person to another depending on the cause. If it's pneumonia, or any other viral infection which is airborne, it could be transmitted from one person to another to give the underlying infection, and that infection can eventually migrate into the brain and cause inflammation of the meninges.
So before we end this program, can you briefly tell us how can we prevent meningitis?
How can we prevent meningitis? Like it said, prevention is better than cure.
Exactly.
The first thing in prevention is vaccination. I mean, vaccination is the greatest and the best means by which we can prevent most forms of meningitis. The epidemic form, which I've been talking about since the beginning of our presentation this afternoon, we have vaccines for that. We have the meningo assay and all the group of vaccines available in our different public health units around the country. We can go there and get ourselves vaccinated so that we are kept away from meningitis.
So how much do these vaccines, when they are born, how much do these vaccines cost so people can know and decide to go take their vaccines? Why not today or now?
How much it cost? I think, I'm not sure I can remember, but I think that it should be 10,000. I guess. I can't remember exactly how much it costs, but I guess 10,000.
And that one dose, and it's for a lifetime, or you have to take it repeatedly?
You have one dose, and you can take a booster dose after about 10 years.
Okay. Thank you.
You can take a booster dose after 5 to 10 years.
Okay. Thank you so much, Dr. Ngaka. We are caught with time. That was Dr. Ngaka, that is Dr. Leonard Ngaka, neurologist at the Yaoundé Central Hospital. And that's it for this edition of the program You're in Your Health aired on Equinoxe Radio Multimedia. For presentation, I am Immaculate Fogo, and I received technical assistance from Ephraim Yemeli. Stay blessed in the company of more programs on Equinoxe Radio and television. So long.
Thank you very much.